Okay, hello, this is Brother Wolf. This is for HS 375. Tonight is group 5, and they are presenting on rehabilitation centers, one of our provider types that we're studying this semester. And I will turn it over to the group whenever they're ready.
So, like Brother Wolf has said, we are presenting on rehabilitation centers. What is a rehabilitation center? In short, it is a hybrid of acute care hospital and long-term care facility. The purpose is to treat various medical issues that remain after stabilization of an acute medical issue. These issues may be neurological, skeletal, muscular, orthopedic, etc. Rehabilitation facilities provide a higher level of care than skilled nursing facilities at a lower cost than acute care hospitals. They are shown to have more successful outcomes in recovery than nursing homes or skilled nursing facilities. Management challenges and opportunities. Some of the opportunities are less costly operations than an acute care hospital on a per diem basis. Public relation ease. Rehabilitation services are investments, saving money by replacing later, more costly treatments. Administrator and training programs are available, leading to a licensure. And some of the challenges are it's extremely fast-paced environment with an ever-evolving priorities, decline in reimbursement rates, while the population of patients needing the therapies grow. It's managed care, have stringent rules leading to greater time needed to document the treatments that are medically necessary.
All right, so some components of an inpatient rehabilitation facility. Rehabilitation facilities treat neurological, musculoskeletal, orthopedic, and other issues by offering the following professional therapies. Physical therapy, which remedies impairments and promotes mobility. Occupational therapy, which is to develop, recover, or maintain ADLs. Respiratory therapy, which is specialists in cardiology, pulmonology, and airway management. Speech therapy, which evaluates and treats communication and swallowing disorders. And then treatment is provided in an inpatient setting, similar to a hospital, and overseen by a rehabilitation physician.
Comprehensive outpatient rehabilitation facilities, or CORFs. A CORF is a facility that is primarily engaged in providing outpatient rehabilitation for the treatment of Medicare beneficiaries who are injured, disabled, or recovering from an illness. The type of skilled rehabilitation services are defined as services that require the skill of a physical therapist, occupational therapist, speech language pathologist, or respiratory therapist. It must provide, at minimum, physician services, physical therapy, and social or psychological services. A rehabilitation facility qualifies for CMS certification. The list of requirements and steps are found in a 441-page document that can be found on CMS's webpage. There are 3 types of provider organizations. First is public health agency, and that is defined as an official agency established by a state or local government, the primary function of which is to maintain the health of the population served by providing environmental health services, preventative medical services, and in certain instances, therapeutic services. A rehabilitation agency is defined as an agency that provides an integrated multidisciplinary program designed to upgrade the physical functions of the handicapped or disabled individuals by bringing together as a team specialized rehabilitation personnel. And a clinic has a broader definition. It's a facility that is established primarily for the provision of outpatient physician services. And to meet this definition, it has to have medical services of the clinic are provided by a group of 3 or more physicians practicing medicine together, and a physician is present in the clinic at all times during hours of operation to perform medical services rather than only administrative services. Accreditation for rehabilitation facilities is through the Commission on Accreditation of Rehabilitation Facilities, or CARF. It was founded in 1966 by the merger of the Association of Rehabilitation Centers and the National Association of Sheltered Workshops and Homebound Programs, with the assistance of Mary E. Switzer, the Commissioner of Social and Rehabilitation for the United States. It is an alternative to the Joint Commission's accreditation. It provides accreditation standards for aging services, behavioral services, DEMPOs, and medical rehabilitation, to name just a few. It's headquartered in Tucson, Arizona.
The Medicare reimbursement for rehabilitation works this way. Medicare Part A reimburses up to 100 days of inpatient treatment per benefit period or episode. The patient may be treated to a rehabilitation center after a 3-day inpatient stay at an acute care hospital. Also, benefit period or episode is considered complete after patient has been discharged from all hospitals, rehabilitation centers, and skilled nursing facilities for at least 60 calendar days. Hence, or once the 60-day calendar have passed, the next admittance to an acute care facility will be considered a new benefit period, eligible for the above benefits. And the role of medication, the role of Medicaid in rehabilitation reimbursements works in that the service provided for rehabilitation centers, such as physical, occupational, respiratory, and speech therapies, are considered optional benefits under the federal Medicaid program. Also, states establish and administer their own programs to determine the type, amount, duration, and scope of services provided to Medicaid patients.
All right, so some of the local and regional inpatient rehabilitation facilities. Health South East Valley Rehabilitation Hospital. It's located here in Mesa, Arizona. It's part of Health South, which operates freestanding rehabilitation facilities in 28 different states. It offers numerous different inpatient, outpatient, and support group services, and it's Joint Commission accredited. Then there's the University of Utah Healthcare Rehabilitation Center, which is in Salt Lake, and it's part of the University of Utah Healthcare in connection with the acute care hospital, and it offers specialty programs for strokes, brain and spinal cord injuries. And then there's the Rehabilitation Hospital of the Northwest, which is in Post Falls, Idaho, and it's part of Ernest Health, which operates both inpatient rehabilitation and acute care facilities. And it's located across 11 different states. It offers a full array of occupational, physical, respiratory, and speech therapies. So who typically owns or manages rehabilitation facilities? A great majority of inpatient rehabilitation facilities are owned and operated as part of acute care hospitals. Organizations such as Health South may specialize in freestanding inpatient rehabilitation facilities. Outpatient facilities and clinics may be freestanding or part of an acute care hospital or medical system. If freestanding, they may be physician or clinician owned.
What is Health South? Health South Corporation is the largest provider of inpatient rehabilitation facilities and hospitals in the United States. They're operational in 33 states, including Puerto Rico. Quote from their website: a higher level of rehabilitative care to patients who are recovering from conditions such as stroke and other neurological disorders, cardiac and pulmonary conditions, brain and spinal cord injuries, complex orthopedic conditions, and amputations. Its subsidiary, Encompass, provides a comprehensive range of Medicare-certified home nursing services to adult patients, and in some markets, in-home hospice services and home care services for pediatric patients with severe medical conditions. As far as national advocacy organizations go for the rehabilitation facility segment of the healthcare industry, there is NARA, or the National Association of Rehabilitation Providers and Agencies, and it represents more than 30,000 therapists, rehab providers, and rehab support organizations nationwide. Represents all therapy disciplines in all settings and advocates for both inpatient and outpatient services and providers. As far as the size of the rehabilitation facility segment within the U.S. healthcare industry, freestanding inpatient rehabilitation facilities in 2014 was up to 251. Hospital-based in IRFs in 2014 was 926. The average Medicare margin for IRFs was 12.5%. Total Medicare patients in IRFs in 2014 was 338,887. The average payment in 2014 was 18,632, and the average length of stay in 2014 in IRFs was 12.8 days. And that.
Excellent. So I think your group, this is probably the best presentation on this topic that I've seen in the probably 3 or 4 semesters I've been teaching the class. Very, very well done. There was not a lot of fluff. That's what I like. It was to the point, and you hit all the main points. So excellent work. Let me talk a little bit about, you brought up some really good points about licenses and accreditation and certification. And sometimes people in the industry even erroneously use those terms interchangeably, and they're not really interchangeable. So let's kind of talk about these 3 buckets: a state license versus a certification from CMS versus accreditation. So just so everyone knows, when we talk about licenses, licenses aren't granted by CMS. CMS is a payer, right? Now they're a large payer, and what they say affects the market in a great way, but it doesn't mean that you get the license from CMS. So the license comes from the state. Now states may use certain criteria that other organizations have published in order to grant licenses. So they might use some CMS information in granting license, but the license is granted from the state. Now, you also mentioned certification. So certification from CMS, I should be more specific, that is specific just for CMS, right? So if you're wanting to be a provider for Medicare or Medicaid, and CMS has certain rules, and you mentioned, the 400 and whatever pages, and there's probably even more regulations that are coming out every week. That is more along a payer certification, right? But it's a big deal because they're a huge payer. And in rehab, we're talking, like you mentioned, I think it was on your Health South slide, you were talking about the kind of conditions, strokes, that's a big one, cardiac and pulmonary, orthopedic injuries, I think you mentioned spinal cord injuries, and then you might have amputations. Anything that has kind of this, after the main event, after the main surgery or the main, like a stroke or something like that, there's a long period of time where people need help in kind of getting that intensive rehab. And versus accreditation. So you mentioned CARF, which is absolutely correct. That's one of the major accrediting agencies for rehab facilities. And then you also mentioned Joint Commission. So just kind of keep those buckets, and I'm not just talking to your group, I'm now talking to the whole class, kind of keep those buckets straight in your mind, that in some states maybe it's required to get an accreditation in order to get a license, but just kind of keep those things separate. Does that? And let me ask the group if you kind of came across kind of those nuances, and did you pick up on some of those nuances, and maybe you had done additional research. Do you have any comments on that? And if you don't, that's fine.
It was pretty, because this isn't the first health sciences class, the hospital management class. We had the first one that really delved into the difference between certifications and accreditations. So.
Yep.
Yeah.
That's right, in HS 285. And so that's a good point. and some of this material overlaps a little bit with that, and I kind of wanted to reemphasize that in case folks hadn't taken that class, more recently, and they may have forgotten that. And so, but that's absolutely right. And then you talked about Health South. They're by far the biggest inpatient national provider of inpatient rehab. And you talked about the Medicare reimbursement. I'm just jotting down, looking at my notes here. You talked about inpatient versus outpatient rehab facilities. So, there's both types. You talked about the CORFs, which are the comprehensive outpatient rehab facilities. And then I just wanted to touch on something that the group was not asked to necessarily address, but some students sometimes ask me questions about it. So they think of rehab, if you talk about Johnny down the street, yeah, he went to rehab. When you think of rehab, sometimes people immediately think of, and it can be appropriate because it's rehab, like drug or alcohol rehabilitation. So those are definitely rehab centers, so to speak, but they're not really what we're talking about here. We're talking more about medical. I don't want to say that addiction's not really a medical problem, but more kind of physical problems.
Injury related.
Injuries or strokes or heart attacks or those heart failure, those kinds of conditions. So just don't get those mixed up. They're still legitimate rehab centers where people are seeking drug rehabilitation. Those are typically more privately owned type of entities, and private pay comes into that a lot more. Though there is a lot of overlap and mix of things with certain, like if you get like a Intermountain Healthcare or a large fully integrated health system, they're going to offer both kinds of rehabilitation. So just kind of keep that in mind, that those are different. Well, I don't have much more to say. You guys did a great job. I really appreciate your excellent work. The clarity was spot on, and that's, to me, that clarity and simplicity with the appropriate level of detail is really important. So I think you guys hit it out of the park. Any last minute comments or questions?
No, thank you.
No, thank you.
Awesome. Okay. Thanks so much. Have a good night.
All right, thank you.
Bye-bye.